Hello everyone. Welcome to another session of Path to Success. Myself Dr. Deepa. I am working in Ma Basilius Dental College, Kodamangalam. So today I am going to take a class on Cementum. So Cementum, as you all know, it's a yellow highlighted portion which is seen here. It is basically covering the root surface and it is a mineralized tooth structure. So today in my lecture, I am talking about various points under the physical and chemical properties of cementum, development of cementum, what are the types of cementum you have, and what are the different types of junctions you have in cementum, and why do we need cementum, what are the functions of cementum, and what are the clinical considerations when you think of cementum, and what are the 8 changes you have in cementum. Okay, so I hope after my lecture you'll be having an idea of all these subheadings. So cementum is a hard, each terms are important, okay? Hard, avascular connective tissue that covers the root of the teeth. Okay, so this definition is given in the 10K. And it is one of the tissue of the periodontium. Okay, I hope you all know what the word periodontium means. So periodontium means surrounding the tooth. So surrounding the tooth you have basically, you have two hard tissue and you have two soft tissue. Okay, so soft tissue components are gingiva and the periodontal ligament, and the hard tissue components are cementum and the alveolar bone. So cementum is one of the components of the tissues of the periodontium. Okay, so cementum is basically providing anchorage for the collagen fiber bundles of the periodontal ligament. So basically it's helping the tooth to remain in its position. Okay, that is one of the important role of cementum. And the cementum, if you see, it is extending from, you all know, it starts from the cervical region and continues to the apex. And you must also know the thickness also varies, and the thickness is less towards the cemento-enamel junction, and as it comes down, the thickness increases up to 200 micrometer. Okay, there are more differences. There are more, there are different types of cementum also you have. Okay, all that we'll be seeing in the coming slides. Okay, so let's talk about various properties of the cementum. Okay, so if you compare with other dental tissues, hard tissues like dentine, okay, its hardness is less as compared to the dentine. That means dentine is more mineralized. Okay, you all know enamel is the most mineralized dental hard tissue, and after that dentine, then only cementum is coming. Okay, similarly, if you see the color, its color is light yellow in color, but its color is slightly lighter in color as compared to the dentine. Similarly, if you compare it with enamel, okay, it lacks the translucency which you have in enamel. So if you see dentine, enamel and cementum, I hope you can differentiate which portion is enamel, which portion is dentine, which portion is cementum. Okay, not only based on the location, otherwise also based on its color, based on its hardness. Okay, and if you compare it with bone, cementum is avascular and non-innervated. Okay, so this is very important. It's avascular and it's non-innervated. We'll be discussing further in detail about these points in the clinical consideration. Okay, so physically how cementum differs from other periodontal structures, you know. Similarly, when you see the chemical property, chemical means what all the cementum is composed of. I told you its mineralization is less. Okay, so it has got only 45% inorganic composition and the 50 to 55 organic, so slightly higher organic percentage we have. And just like other dental tissues, the inorganic portion is mainly composed of calcium and phosphate in the form of hydroxyapatite. Okay, and it is one of the tissue which has got highest fluoride content. This is an important MCQ question. Okay, the dental tissue which has got highest fluoride content is cementum. Okay, and if you see the organic portion in detail, just like other hard tissues, dental tissues, type 1 collagen is the predominant part, and we have other various non-collagenous proteins like bone protein, osteochondrin, etc. Okay, but there is one protein known as cementum derived attachment protein. That is a unique protein you have in cementum. Okay, so I hope you got an idea about physical chemical property of cementum. Okay, So next we are going to the next important portion, that is cementogenesis, how cementum is getting formed. Okay, first let me explain this picture to you all. Okay, this is a stage, the advanced bell stage, where you can see enamel dentine formation. So this is the outer enamel epithelium and this is the inner enamel epithelium. You can see this portion, cervical loop, isn't it? So cervical loop is nothing but where the inner and outer enamel epithelium meets. Okay, the importance of cervical loop is that cervical loop further proliferates down. Okay, once the crown portion is complete, the cervical loop further proliferates down and forms the HERS, that is Herdwick epithelial root sheath, which has got important role in the root formation. Okay, so HERS has got important role in the development of cementum as well. Okay, coming to the next slide. So this is explaining the minor details of cementogenesis. Just like amelogenesis, you all know in amelogenesis, the dentine is getting formed first, then the enamel. Similarly, here also from the dental papilla cell, odontoblast is getting derived and the dentine is getting deposited. After that, there will be some break. You know, there is this outermost HERS here. There are certain breaks or fenestrations taking place in the HERS, and the surrounding dental follicle cell derive cementoblast, and the cementoblast starts laying down cementum. Okay, so the first odontoblast starts secreting dentine. Okay, after which there is break in this HERS, that is Herdwick epithelial root sheath, and from the surrounding dental follicle cell, cementoblast is getting derived, and the cementoblast starts laying down cementum. Okay, I hope it is clear. This is just the written matter of whatever I told you. Okay, so basically you must know that cementoblast is the cell which is laying down cementum. So before going to the types of cementum, let's talk about what are the different types of cells we have in cementum. Just now I told you about cementoblast, isn't it? In this picture you can see cementoblast. These are the blast cells or synthetic cells responsible for laying down cementum. So it is seen on the root surface. Okay, and it lays down the dentine. It lays down the cementum. Okay, and cementocytes. Cementocytes are nothing but these are embedded in these are cementoblasts which are embedded in the cementum. Okay, so after depositing cementum, certain cementoblasts gets infrared and they are only known as cementocytes. And one thing we can notice in this picture that the cementocytes has got certain projections known as canaliculae, and these projections are unidirectional. That is, these are a viable cell, and this has to get nutrition, and these cells are getting nutrition from the periodontal ligament side. So the canaliculae projections are unidirectional, whereas if you see in case of osteocytes, those are multidirectional. Okay, the cementocytes has access from nutrition only from the periodontal ligament side. The other side is dentine, that is completely mineralized. It cannot get nutrition. So the canaliculae projections are unidirectional. This point also you must know. So these are the various types of cells you have in cementum. Okay. Okay, so next I told you, so far we have finished about various physical chemical properties of cementum and how cementum is getting formed. Okay, and what are the types of cells you have in cementum. Next we are going to see what all junctions you have in cementum. So first let's discuss about this cemento-enamel junction. Okay, so you can see in this picture enamel, the darker side, and this is a cementum. And you have different types of junctions like overlapping junction, edge-to-edge junction, gap junction. You must remember the percentages also. So the most ideal is edge-to-edge. Okay, but predominantly what we see is overlapping type of junction. Okay, that is cementum overlaps the enamel. So there is a reason why we have most like overlapping, more commonly we get overlapping type of junction. After the crown portion is complete, the reduced enamel epithelium is covering the tooth enamel. So sometimes there is early degeneration of this reduced enamel epithelium, and from the surrounding dental follicle cell, cementoblast starts laying down cementum. Okay, so we have this overlapping type of junction predominant. Okay, similarly, in gap junctions, what happens is there is a failure of retraction, failure or delay of retraction of reduced normal epithelium, and after that, after a certain time, only the cementoblast starts laying down cementum. So there is this formation of this gap junction. Okay, so different types of junctions and about the percentages you must know. This is a commonly exam, like you can get this question for your exams. Similarly, next type of junction is cementodentinal, where the cementum is meeting with the dentine. Okay, as you can see in this picture, it is smooth. This side is a cementum, and we can see this tubule. This is a dentinal side. Okay, and so this junction, this is smooth in permanent, and whereas this is scallop in deciduous. Okay, if you remember the dentino-enamel junction, it is scallop, as the dentine and enamel should have a strong adherence. It is scallop, whereas the cementodentinal junction permanent, it is smooth. Okay, similarly in this picture, in the dentinal side, you can see these incremental lines. You know, incremental lines of red CS you have in enamel. Similarly, in cementum, these incremental lines are known as incremental lines of Salter, which indicate the periodic formation of cementum. Okay. This point, intermediate cementum or hyaline layer, this is also commonly, you can get this question for your university exam. First, I'll explain this picture. Okay, this picture, this A portion is the cementum region, this D side is the dentine side. Okay, the C, this granular region is the Tom's granular layer, which you have, you may get in root dentine. Okay, so this B is the hyaline layer or this intermediate cementum. Okay, intermediate, that is intermediate layer between the cementum and the dentine. And why it is known as hyaline layer? Because it's structureless. It doesn't show any characteristic of cementum, neither dentine. So it is known as hyaline layer of Hopple-Smith, and it's predominantly seen in the apical two-third of the root. Okay, so this is about intermediate cementum or hyaline layer of Hopple-Smith. In theory exam as well as for Viva, you can get this question. Okay, so I think half of my class is over so far. Okay, next we are going to see what are the types of cementum you have, how you can classify cementum. Okay, so basically based on the presence or absence of cells, we just saw about cementocytes, isn't it? So presence or absence of cementocytes, we can say acellular or cellular. Other name for acellular is primary or the first form cementum. Cellular cementum is a secondary cementum. Okay, and the difference between acellular and cellular in the coming slide I will be explaining. That is very important. Okay, and based on origin of collagen fibers. Okay, you must understand the term intrinsic fiber, that is from within the cementum. Those are intrinsic fiber. These are fibers which are derived from the cementoblast. Similarly, extrinsic fiber, that is something which is coming from outside, that is from the PDL, the Sharpie fibers. So you must understand the difference between intrinsic fiber and extrinsic fiber. Okay, so this is how, based on all these features, you can classify cementum. And this Schroeder in 1986, he has proposed this classification based on the cellularity and based on the fibrillarity. Okay, so you must understand the term acellular, afibrillar, no cells, no fibers. This is more commonly seen towards the like coronal part of the cementum. Okay, similarly acellular, extrinsic fiber, that is no cells, but you have this Sharpie fibers there. Cellular, mixed, you have cells, you have both intrinsic as well as extrinsic. Similarly, cellular, intrinsic fiber, cellularity is there, and only this cementoblast derived fibers are there. Acellular, intrinsic, similarly no cells, but we have this certain cemental fibers there. So Schroeder's classification, this 5 types of cementum also you must know. Even the location also varies, that also you must know. Okay, so this is commonly very important question from this chapter, that is difference between acellular and cellular cementum. Okay, so like you can see in this picture, acellular is predominantly, first I'll narrate the difference, then we'll read out the points one by one. The first picture, that is acellular cementum, is seen towards the coronal, towards the cervical region, and the cellular is seen more towards the apical region. That is one difference between the location difference. And acellular, other name is primary cementum, and cellular secondary cementum. Okay, acellular is a first form cementum and cellular forms later. Okay, similarly, as the term says, acellular means no cellularity. Cellular means which has got embedded cementocytes, like you can see in this picture. Okay, see for picture under the acellular cementum, picture under the cellular cementum. Just compare. The C is a cemental portion. The width is more or less constant. Here it's more wider, and it has got cementocytes here. Okay. Now let's read the point one by one. Embedded cementocytes are absent, present. Deposition rate is slower, faster. First form layer, width more or less constant, found more at the cervical third. Primary cementum, sharpy fibers are well mineralized. That is, in acellular cementum, cellularity is less, so the inorganic portion it is more, less organic portion. So sharpy fibers are well mineralized. Incremental lines are regular and closely spaced. As the deposition rate is lower, incremental lines are more regular. Okay. So I hope difference between cellular and acellular is clear. So whenever a questions like difference and all is asked, you must write it in the table format. You must write this difference, and you must, if you can draw this diagram, well and good. Okay. So we are coming towards the end of this lecture. Okay. Now only few more slides are remaining. The remaining slides we are talking functions of cementum, clinical consideration, and age changes. Only 3 more slides. So functions, I already told you about anchorage. Basically, it's providing a medium of attachment. The collagen fibers are getting inserted into the cementum one side, and other side it's getting inserted in the alveolar bone. So it's providing the anchorage. Functional adaptation. If there is any minor disturbance and all, cementum has the capacity to adapt. Repair. Similarly, cementoblast forms cementum, and it can undergo some kind of resorption. So anchorage, functional adaptation, repair, these are the functions of cementum. Next, coming to the clinical consideration. I told you in the first slide that unlike bone, cementum is avascular and non-innervated. So cementum is resistant to the tooth, resistant to the resorption. So whenever this orthodontic to the folds and all is applied, cementum is not resorbing. It is bone which is getting resorbed, and the cementum is, the tooth is just moving. Like, so the cementum is not resorbing, only bone is resorbing, because of this reason the orthodontic tooth movement is possible. Similarly, I told you cementum can undergo some kind of repair, isn't it? In this picture you can see there are 2 types of repair known as anatomic repair and functional repair. Anatomic repair means whenever there is small resorbed area and all, and the cementum can just repair and just maintain the anatomy of the tooth. Whereas in case of functional repair, the tooth function is getting modified, but it is not maintained the anatomical relations. So anatomical repair, functional repair. Okay. So these are the 2 major clinical considerations you must know under this cementum. And the last is age changes of cementum. So as the person undergoes aging, there will be some occlusal wear and all. So the tooth will have some passive eruption. So in the apical region, the cellular cementum deposits few cementum, and so there is increased thickness of cementum. Similarly, as the patient ages, you all know the cellularity decreases. Similarly, the cells in cementum, there are cementocytes, there is degeneration. Okay, so these are the 2 major changes, major age changes which we have in cementum. Okay, so I hope whatever I wanted to tell you, it's clear for you all. Okay, and these are my references. Thank you.